All right, guys, and welcome. Today we're going to be talking about a herniated disc and what that exactly looks like. I know a lot of people out there get diagnosed with a herniated disc, and one of the biggest things that we see in the clinic is we have to make sure that the symptoms of the disc herniation and the symptoms that the person is feeling and what's also being tested clinically match up so that we know with 100% certainty that we can treat the discs and we can treat it successfully. So without further ado, I'm going to start a video for you guys here. You're going to see basically L5, 4, 3, 2, 1. You're going to see the discs in between here. I'm going to stop. I'm going to come back to that photo there for a second. A disc is this area right here in between the vertebrae. If this is L5 and this is L4, a disc is named because it's between L5 and L4. It's pretty simple. These little yellow things you see are nerve roots. They're cut here just for this video's sake. But at the same time, they're a little bit longer. They go down the legs, they go out to the sides. What you're going to see in this structure here is normal function of lumbar vertebrae and disc. You have the nucleus in the middle, you have the annulus rings on the outside here. A disc is made predominantly of water. So people like to make a comparison to a jelly donut. It is not a jelly donut. You cannot eat it. It's not sugary. I'm not sure how a disc tastes, but it's definitely not a jelly donut. It's actually kind of more of a firm, harder surface. So the inside nucleus here has, and then this is your cartilaginous rings that are around here. The inside is going to be a little bit more intact. The outside rings are what's going to be broken down. A bulge is when the rings are still kind of intact, but they're going to be kind of protruding out a little bit because the nucleus is going to start to come out that way. And then a herniation is when the annulus tears and now the whole nucleus is exposed. So I'm going to play the video a little bit here. It's just going to let it ride here. As you can see, normal function, bending forward, bending back. Here's the spinal cord. Here's the nerve roots. Disc degeneration, you're going to start to see that breakdown in the disc itself. You're going to get to the position here where, as you can see, the bulge slash herniation is starting to occur back on the spinal cord. You're going to kind of ride it through a little bit more here. I apologize. There is a little bit of a lag in my video here, but that's okay. And we'll just pause it. So the disc herniation is pushing on the spinal cord, and then you have the nerve roots down. Now, I do want to point out something real quick. It is kind of rare for the disc herniation itself to go right onto the spinal cord. Usually, if that's the case, you have numbness and tingling down both legs, not necessarily past the knee, but at least down both legs, through the glutes, through the hamstrings, into that area. And then potentially, if it's really severe, it's going to be going all the way down each leg. But most of the time, what we do see is that we do see a disc herniation more towards the nerve roots itself. So a lot of times people would herniate a disc at L5S1 on the right-hand side, and it would be numbness and tingling down the right. But that does go to say that they could have a L4, L5 disc herniation on the left-hand side and be having symptoms there. So you really just got to make sure that everything lines up. You got to check the image. You got to make sure that the MRI, the X-ray, it's showing this information, and then the symptoms and everything is lining up itself. So this is a disc herniation that we just took part in. One thing that I want to say with a disc herniation is usually disc herniations are between anybody 20, 25, all the way up to like 60. It hurts when you bend down and touch your toes. It hurts with sitting. It hurts with driving. Sometimes that change in position really bothers you. But a lot of people, when they bend forward, okay, so you're going to bend forward. Now, what I want to do is I'm going to take you back on the video a little bit here. Is the reason why that's the case is, as you can see, it's bending forward. Now, as you bend down forward here, you're going to pinch off the front part of the disc, and that's going to put pressure, so it's going to push the disc back. That's why when you bend down and touch your toes, it might cause some extra numbness and tingling. When you lean back, okay, so if anybody's familiar with some of the more extension-based exercises, then those exercises are going to help a disc herniation in theory. Flexion-based activities like crunches, knees to chest, bending down, touching your toes, deadlifts, remain deadlifts, kettlebell swings, kettlebell pickups, or bent over rows. Man, that stuff is going to flare up your disc herniation or even put you at risk of causing a disc herniation. So, so Yeah, so excuse me. Most people with the disc herniation feel better when they lean back. So, like hands across your lower back, just kind of lean them back a couple degrees, hold that position, and then back. And then that's kind of how most people respond to a disc herniation. So, once again, this is Robert. I'm reviewing the videos here with you guys. The next one that we'll probably be doing is spinal stenosis. So, if you know anybody who could benefit from a herniated disc video, I would like you guys to like or share our page. Also, if you guys want to subscribe to our page, you're going to see a lot of cool videos here. We're going to be uploading for different conditions that you could use. If you guys are providers using these videos, awesome. And then if you're a patient or just general public looking to get some information, comment down below if it was beneficial for you guys to learn. And then if there's anything else that you guys want to learn, comment there as well. Thank you. And once again, thanks for watching.